Well, hello, Dr. George Bobbitt here. I have some information for you on the emotions of anger and patience. So let's talk about this. When you understand certain laws of the universe, you understand how to utilize our emotions constructively. But before we can do that, I want you to understand why someone might want to study emotions. Why would a chiropractor decide to teach about emotion? Well, here's the fact of the matter is 80% of our diseases, of our sicknesses, our pathologies can have their origin in the mind, in the thoughts. And then the thoughts, if they don't get expressed correctly, then they show up as disease. So I want to show you this. Here's this idea. If we have anger on this side and patience on this side, these are the polar opposites of each other. In an ideal situation, we would have it just is. We'd have an event. It's just an event. It's not making us angry. It's not making us patient. It's just an event. How we respond to it, however, is where the work comes in. So we have an event. And let's say that this event is just that to you. It's no big deal. You're not attached to it. So you might get a little bit angry about a swing over here. And then when that happens, well, it doesn't take a whole lot to make you patient. The swing is very little. And then let's say that events stack on top of each other. And now you find yourself at a level of angry here. Well, it's going to take a level of patience to here to neutralize you back to the center. And then as we go down, let's say you have a lot of anger. It's going to take quite a bit of patience to neutralize that anger. Well, the goal for these classes that we're teaching is to help somebody take a negative emotion and neutralize it so then they can step up a notch and begin to reason on what they can do so that they don't find themselves in that situation again and make themselves sick, because these emotions will get stored in the body. So here's how it would work. Let's say that you have this negative swing way out here. You are very, very mad, very angry. Well, when you're out here, your body releases certain chemicals, certain chemistry. And if that chemistry stays in the body too long, when that chemistry is lopsided or you have a chemical imbalance, it can lead to disease. And we'll treat it with medicine, but we never treated the cause of the disease. We're just treating the symptoms of the disease, and we label it with some special diagnosis. So as you come down, as you manage your anger, and as you neutralize your anger, the chemistry changes, and it changes more and more until you get back to center, back to a balanced mind, which would then mean balanced body. We tend to usually think of the negative because most of us were focused on that. Not too many people say, I'm too patient, or I have all the patience I ever need. I'm never angry. So we focus on that. But when we teach, we're going to teach how anger changes the mind and how the mind then changes the body. And it's very simple. You get to do it yourself. Now, once you go from here to here and you're neutralized, you step up to a new level. And in that new level, you're less polarized, you're less emotional. So you still swing. You're going to swing. It's just the swing is less. Now you're only a -5, so your chemistry only gets lopsided a little bit. And the quicker you bring it back to neutral, the healthier you are. And then you bring it to neutral, and then you rise to the next level. And then now your swing is less in that event. So before long, you no longer see this event as something bad or traumatic. You see it just as an event, and your chemistry doesn't go off the charts and you don't get sick. So it's a worthwhile study to understand how to balance emotions and how our emotions impact our body, how our psychology impacts the physiology. And that's what we're doing with our teachings. We're helping people understand that if they can manage that and understand that and neutralize their negative emotions, then they'll be healthier overall.